Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi-Spa. Welcome to our holiday version of Facebook Live here tonight. So we are just about finished with the 2019 year, and we're fast approaching 2020 and a new decade. So we felt that tonight maybe we'll talk about some new trends, maybe what's going to be the hot topics for 2020. And so we're happy to answer any questions you might have tonight. Make sure that you text us any questions or through the Facebook Live, and we'll be happy to answer them for you. So let's kick it off tonight about maybe some new popular trends.
Well, with all the New Year's resolutions made after the first of the year, do you see an increase in plastic surgery inquiries?
We've actually seen a significant rise in the inquiries to the practice over the past month and a half. This is a time when patients, as you come into that new year, as I said, you have the resolutions. People are trying to figure out maybe what they want to do, get ready for spring, certainly for summer. So this is the planning stage. But this year we've seen a significant rise in what we normally see. So, and these are inquiries not only just about plastic surgery procedures, but also the Medi-Spa procedures, dermal fillers, lasers, so a lot of non-invasive and invasive procedures.
Do you see the cosmetic industry changing in 2020?
I think the industry itself is evolving, and what we're finding is that patients are much more educated. I think that there is a lot more research going on. Patients are becoming more savvy. So I think what we're finding is that the industry has changed because there's been more thrust on adapting or creating better non-surgical technologies. And so I think that's what we're seeing from the biomedical standpoint. We're going to start looking at dermal fillers that last longer. We're going to look at non-invasive treatments for skin tightening, maybe controlling fat more than liposuction. Up to this point, we haven't really seen it having that much of an impact as far as the results. But I think in 2020, we're going to start seeing more companies getting involved with the non-invasive procedures.
How do you feel about influencers? Do you think they will continue to play a role in the beauty standard?
I think for the first time, we're really starting to see that Hollywood and major influencers are having less impact. I don't hear certain Hollywood families that are well known even being mentioned anymore, and I think that's a good trend. I think people are really coming in because they want to talk about correcting things that have always bothered them, or things that have developed as they've gotten older or after pregnancies. Even for men, we have more men coming in now, trying to just maintain a certain look. As I said before, men are maintaining their body habitus is better by exercise, eating cleaner. So the aging process would like to be reversed or controlled more. So I think we're seeing more patients now that are savvy, that really want to control what they want to control. They're not looking to Hollywood people to sort of tell them what is beautiful or what the trend should be. So I'm really pleased to see that. I think patients are coming in just looking for that individual care and that we can give.
What are the top 5 surgical procedures that you think will continue on the most desired list?
I think breast augmentation is always going to be in the top, at least top 2. And I'm not seeing any downfall to that. We're still a very active practice for breast augmentation. Also, re-augmentation, so correcting different problems with implants that they've developed over the years, or surgeries elsewhere that have not been up to the patient standards. So we're seeing a lot of that. I think eyelid surgery, facial surgery for us is rapidly increasing with every year. Liposuction will continue to be a body contouring surgery that patients want to have, especially when patients, as you go through the winter months here in Western Pennsylvania, maybe not exercising as much, holidays are tough for eating, so liposuction will always be one of the top procedures. For a lot of women, tummy tucks combined with liposuction will be a desired surgery. The last thing is rhinoplasties or nasal surgery. That will continue to be on the list. I've seen that kind of drop off over the years, patients asking me about it, but it's still probably in the top 5.
Patricia wants to know, do you do eye lifts, and what is the downtime?
I do eye lifts. I love eye lifts. It's one of the surgeries that it's moved way up on my list. The downtime is about a week to 2 weeks. I don't let patients exercise for about 3 weeks, but getting you back into the workplace or back out in public, it may be a week, 2 weeks on the outside. So the nice thing about the eyelid surgery, it's almost painless, even for men and women. You get maybe a little bit of swelling that is mostly gone in a couple of weeks, and maybe some mild bruising if you're doing your lower eyelids. So thank you for the question.
Talking again about procedures that are gaining popularity in 2020, you'd mentioned fat transfers previously. Can you talk a little bit about that, and are they being combined with anything?
Fat transfers are on the rise. I think they've been the hot topic for the last several years. I think that there's enough evidence out there now that patients are more savvy about it. I think when patients come in, they have this idea that we're able to just harvest fat from some area and just put it in as a big ball to build a breast or to build a buttock. And that's really not true. And so these are things, if you're thinking about that, you really need to talk to a plastic surgeon that does it a fair amount. It's a conversation with me that is a good at least 45 minutes. I try to dispel a lot of the myths that are out there. But patients need to understand this is living tissue with a blood supply. We're taking it from one area and we're transferring it to another area. And as I tell patients, it's not like just putting in an implant that you can just put in as a big sort of a ball. We have to actually transfer fat in very thin lines and about 2 millimeters in width, because the blood supply has to grow into those cells. If you put in a large, what we call a bolus of tissue, the blood supply comes to the outside and can revascularize that tissue, but the inside fat tissue is not going to get vascularized in time before that cell dies. The cell will only last about 5 to 6, 7 days without a good blood supply. So we have to put it in very thin lines so that that increases the chance that it would become revascularized. So in doing that, you're laying it in very thin lines. And so the other couple of things that you have to remember is that, in all honesty, fat transfers take approximately 2, maybe even 3 surgeries to get the look that you want. About 70% of what we put in will survive, but it can be less than that. So if you're doing both breasts or both buttocks, you might have 70% take on one side, you might have 50% take on the other. So you have this asymmetry that you might need to correct. So you have to be careful with that. Any type of pressure or any type of activity, you can't exercise for 6 weeks. So it's a good procedure, but it's not a one and done. It's not something you can just waltz in, have it done, walk out, get back to your lifestyle. It has more downtime than most surgeries that we do. That being said, I enjoy doing them, but I like to use fat transfers almost as an adjunct to other things that I do. We're using fat transfers as part of an augmentation, so we put in an implant, and then for ladies that want to build more cleavage, you can actually put fat in the inside of the breast and build more cleavage that way. For ladies that have had implants over the years and may develop a little bit of rippling, you can actually do fat transfers to camouflage the rippling. So we're using it as an adjunct. For facial surgeries, we can do fat transfers to the cheeks, fat transfers to the lower jawline, filling in those areas that may not be corrected completely with a facelift surgery. There are other areas of contouring. Ladies have had lumpectomies for breast cancer and radiation. Fat transfers to those areas work very well as well as in other areas of the body. So I like to use the fat more as an adjunct than just to try to do volume. I still think breast implants are safe. I still think that they are the best way if you want to come in for gaining volume. One swoop surgery, easy recovery, one downtime. I still think that's the best way to go.
I have a question for you. TD wants to know, she's interested in arm lift or lower body lift after losing 97 pounds. Congratulations on that.
Congratulations, yeah.
What is the downtime for each procedure? Arm lift and lower body lift.
Let's start with the arm lift. The arm lift is one of the surgeries, again, I really enjoy doing. The nice thing about the arm lift is you see the results almost immediately. And so you get very little swelling with it. You do have to wear compression for about 3 weeks. So I don't let patients exercise for about 3 weeks after an arm lift, but there's almost no pain with it at all. You can get back to work within a week. So there's a lot of good benefits to that. So nice surgery, good contouring, easy recovery time. A lower body lift, if you have a little bit more downtime. So a lower body lift is really an incision that is on the lower part of the abdomen, circles around the hips, and then comes to the buttock area. So for UTD that's lost that significant amount of weight, taking that tissue, it resuspends and brings the buttock back to a more normal anatomical position. It'll lift the pubic area, tighten the belly, tighten the sides of the hips, so it works well. There are drains with that surgery. You'll need compression for a good 3 to 4 weeks afterwards. Most patients can start exercising a little bit within 3 to 4 weeks. I would tell you you're probably off of work for about 3 to 4 weeks with that surgery. So a little bit more downtime, but most patients have it done. They're very pleased with the results.
Patricia wants to know, does liposuction require draining tubes?
No, at least for me, I've never used drains for liposuction. I have heard that some surgeons do. I think it's drain use is up to the surgeon. I do use drains for certain surgeries. I think they're good when you need them. I just haven't had any reason to use them for liposuction.
Getting back to the procedures gaining popularity in 2020, what do you see body shaping procedures? Where do you see those going?
I think body shaping procedures are always going to be popular. I think they're going to increase over 2020. I think they're going to be combined with maybe other modalities. So for patients like TD who's lost 97 pounds or more, a lot of times that skin's been stretched out, so we've lost elasticity in the skin. There's really no way to really build that elasticity to a significant amount. And so we're seeing sort of the resurgence of radiofrequency with some of these procedures. We use a radiofrequency with microneedling, and we're seeing some good results with that. But it's mild tightening and plumping of the dermis, but it's not going to really lift that much. It just can't possibly do that. So I think you have to be careful with radiofrequency. I like the modality for the device that we have. I think it works well. We do tell patients these are mild effects, but they are combined with something that's going to give you luster, get the tone back of your skin. So that is an overall good effect. But if you're somebody that has a lot of excess skin, especially on the face, the belly, it's not really going to tighten that without surgery. So you have to be careful with that. But I think for other body contouring, arms, breasts, legs, are always going to be something that patients are going to want to do. I think as fashion changes as well, so we're going into a new decade, we sort of follow the fashion that most companies put out for women. So if women, if the fashion shows more short sleeve shirts, tank tops, that kind of fashion, then arm lifts are going to continue to be very popular. Same thing with swimsuits, the way that jeans are cut. So a lot of that we as plastic surgeons sort of respond to and how we contour bodies.
Do you think the exaggerated surgical results we've seen this past decade will continue?
I think that's quickly becoming a thing of the past, and I thank God for that, because I think, again, patients are coming in, they're not looking to see what other people are doing. They're not looking to see what that Hollywood crowd is doing. I think people are really saying, you know what, I just want to be me. I want to be the best version of me, and that's the best way to do it. We want to look at everybody individually. So in our practice, We listen to everybody. A breast augmentation is not a breast augmentation, not a breast augmentation. And nasal surgery is not the same for everybody. It's not a cookie cutter way of doing it. So you should be able to individualize. And when patients come in and say, look, I just want this done, or this is something that's always bothered me, we're not trying to do the, certain type of a buttock or certain type of a thigh gap and, things that we've talked about in the past. I think that a lot of that has gone by the wayside. Women that come in to see me now, and men too, don't want people to know they've had plastic surgery. They want to have a natural look. They want to get back out into the public as soon as possible. They want to get back to exercising as soon as possible. They don't want to have a lot of downtime. They don't want to have to do a lot of compression garments. They don't want to have to do a lot of massaging and extraneous things. So they just want to look their best, and I think that's, for me, it's just the time when it's been the most fun, because I think you can gear that to people knowing we can help that person be them rather than trying to change somebody into somebody they're not. We have to look at their anatomy. So when, in the old times, patients would come in and say, my friend had this done, that's what I want. Or my friend had this size implants, that's what I want. That might look good on their friend, but it may not look good on this person. So individualization is the way to go.
Susan wants to know, is a facelift always the best procedure for loose skin at the jawline and neck for early jowls?
You know what? It isn't. And again, I think this is where dermal fillers really can play a bigger role. So depending upon the age of the patient, the tone of the tissue, the tone of the skin, the thickness of the dermis of the skin, when you start to see a little bit of jowling, a little bit of neck laxity, a lot of patients will come in, they're seeing it for the first time, they're anxious about it. So sometimes the non-invasive or minimally invasive procedures actually look better at that time. So, if we have somebody who's just starting down that line, sometimes doing some dermal fillers back in the lateral or the outside part of the jawline, just under the ear, can pull this back. Really kind of hitting up in the cheek can help decrease the folding here, give you that balance and give you that little bit of a lift that's better than surgery. And I see patients every week that come in, thinking they're going to need surgery and, sort of even reticent to talk about it. So the first thing they want to tell me is, I don't know if I'm ready for surgery, so I said, just tell me what's bothering you and let me help you decide what's best for you. So I think the increase in, like I was talking about, the Vivace machine that we have, which is radio frequency and microneedling, combined with our CO2 laser, can help texture and tone that gloss, give you a little bit of fullness, give a little bit of tightening of the face. I think that buys you time as well. So you don't always need to have surgery.
What are the top non-surgical procedures that were seen last year, and do you see changes coming in the future for 2020?
Well, the top two are always going to be Botox and dermal fillers. I think microneedling has taken off in the last couple of years, but I think now that we're seeing it hooked with other things or combined with radiofrequency and that combining with other procedures, those are increasing. I think a lot of the hair removal or reduction devices have improved. In the past, it's taking 6, 7, 8 treatments, modest amount of reduction. There are some lasers that are out that are much better. We're actually looking at a laser now that is really fascinating and I think has some promising results in maybe just 3 visits. So there are some things like that that are out there. I think moving into 2020, I think Botox and dermal fillers are still going to be at the forefront because they work, they're safe, they're tried and true. I think people trust them. I think if you're really going to go after that, really look at who the injector is, because that's really the rate limiting step. You have to have an injector who's confident, who has the experience, especially when you're looking at things like the tear trough area, the areas under the eyes. Those are some unforgiving areas, and so if you go to an injector with not much experience, you may not get the results that you want. So be careful with that, do your research, but you can do some remarkable things with the dermal fillers. As I said, the lasers are going to continue to improve, so As we've talked about, we bought a couple of devices over this past year. I love my CO2 laser. That's going to get better, and I think some other lasers are on the rise, and we're looking at those as well.
What do you see with injectable products in the next year?
I think some of the things that are coming out now, the things that we're happy about with dermal fillers is they do a good job of giving you a soft, fuller look. I think the things that we're not happy about is the longevity. And now there are some dermal fillers on the market or coming out on the market that may give some promise to maybe 3 to 4 years of results rather than 9 months to a year. We've already have one out that's really good for with Voluma, about 1.5 to 2 years in some patients. But I think you're going to start seeing that, again, that technology has improved the cross-linking of the collagen and those molecules so that you're going to get better lasting and longer lasting products. I think the products are going to be softer and more mobile, so all good things there.
You've talked in the past about skincare being important. Do you see that in the next year?
As long as we have skin, it's always going to be important. We're out in the sun, we're out in the elements, and now, I mean, we're coming into winter, we've got the wind, the cold. Summer, you've got obviously the sun rays. So I think we're never going to get away from the need to have skin care, and we're never going to stop talking about it in this practice. We're not going to stop educating patients about the importance of skin care, the importance of sunscreen. So I think those products are also improving, and keeping that sun damage to a minimum will decrease your risk for skin cancers. Skin cancers continue to grow and increase in number every year. Melanoma continues to rise, and so I think with some skin care at an earlier age will actually help prevent some of these.
Do you also see that as a building block for procedures and treatments when you start with the skincare?
Yeah, I think so. I think patients that are doing skincare in their early 30s, I think that you're going to have much better skin tone, luster, so that as you get into your late 40s and early 50s, you may not see that aging process. Patients that are coming to see me in those age groups and older that have not done it, and we're looking at looking at facelifts, neck lifts, lower facial lifts. We're looking at eyelids. I want to put those patients on to sunscreen, or not sunscreen, but skincare as well, because I want to protect what we've done. We've gone through a surgical procedure. A lot of patients are doing the CO2 treatments that we use as an enhancement to that. So we want to keep that longevity. We want to get your results to last longer than 6, 8 to 10 years. So again, skincare as a building block, as the foundation, and then that's really keeping you going after the procedures are done, after the peels, after the laser therapy. It's like going to the gym and just sort of maintaining things, and skincare, in my opinion, is extremely important for that.
You've talked in the past as well about teamwork involving you as a surgeon, the esthetician, and the injector. Can you touch on that a little bit?
Yeah, I think in the past, I think surgeons have gone out. We've hung a shingle. We're the people doing the surgeries. We add a spa. We've done different things. But I think in the last few years, we've really kind of come to grips with we don't have all the tools in the toolbox. As if any of you have heard when I did our Facebook Live about our CO2 laser, the whole reason I bought that laser was because I couldn't achieve everything I wanted to with just surgery. You can't achieve everything you want to with just skin care or dermal fillers. So certain times of life, the skin care, the dermal fillers are the most important part of it. As we get older, surgery becomes more the leading treatment. But when you put those items together, so when I work with my esthetician, Tara, and I work with Pam and Ashley as our injectors, and we do that, we're getting the best care for the patients. Patients will come in, I can say, you know what, I can put your cheeks back, I can correct your jowling, I can correct the neck laxity, but I can't do anything about the skin tone. So let's talk to Tara about the skin care. Let's talk to her about Vivace. I'll talk to you about the CO2 laser. You still have to do Botox because, again, You still have to have those pull of the muscle. You're going to get those lines up here, the lines in the forehead. Even with surgery, you're going to get those because you're not going to do anything to the muscle pull. So Botox still is an issue. As we get older, we lose fat in our face, so we lose the nice full cheeks. We can correct some of that with surgery, but you might still need an enhancement. That's where fat transfers to the face, or dermal fillers will come in after surgery and really enhance that look. So again, we're looking for a natural look. We're not looking for overfilling. We're not looking for the chipmunk look. We're not looking for the large lips anymore. We're really looking for that natural look that we had as we've gone through the aging process.
Do you think 2020 will address the perimenopausal and menopausal women and their specific needs that occur as hormones change?
Yeah, I think so, because I think the baby boomers are really into that era of their life now, and they're at a time where, as many of the ladies say, you know, I've taken care of my children, I've taken care of the family, now I kind of want to put myself back together. We're in our late 40s, 50s, and 60s now. They have the means to do it. They want to take the time. They have a little bit of downtime that they can afford. And again, a week, maybe 2 weeks. So they want to reestablish themselves. And so I think, honestly, in 2020, I think there's going to be a lot more medicine geared to menopausal women. And that may be coming from the gynecologists. It could be coming from the PCPs. It'd be nice as a plastic surgeon who are seeing these ladies for other reasons if we could all get together again as a team approach. I think that's going to help those ladies, because there's a lot of things out there that we're seeing now in perimenopausal and menopausal women that were never really talked about before, and women want to talk about it now. I have ladies that come in and it's very similar, and I can almost finish their sentences for them, where they're coming in and saying, I'm so frustrated. I go to the gym, I have the same diet, I have little snacks, but I'm really careful what I eat. I haven't gained a pound, but my body is different. I have fat where I never had it. I can't control it. I don't look good at my clothing anymore. And they're really frustrated. This lax, crepey skin, and they're frustrated by it. And I see that all within women between 45 and 60. And when they start coming in, I can say, yes, and you're seeing this, yes, you're seeing that. And they say, how do you know that? It's because I see it all the time. So I'm hoping that from the gynecological standpoint, you know, they're really looking at the hormonal balance, getting together with primary care physicians and looking at what we're doing from a self-esteem and body image in plastic surgery. Maybe we can form some type of a team to help these ladies feel better about themselves and really take control over their body habitus and their hormonal levels.
What are some of the things we should be addressing when looking for a plastic surgeon?
That's not going to change either. I mean, there's nothing is going to take the place of board certification. Again, as we've always said, being board certified in anything is great, but you want to look for somebody. If you're looking for plastic surgery, you need a board certified plastic surgeon. If you want a cardiologist, you want a board certified cardiologist. You don't want somebody who's just doing cardiology. Lots of specialties will try to do plastic surgery or cosmetic surgery. You really want somebody with the experience and the know-how to do it. So looking at experience, you want to look at the office too. You want to look at the staff. Do you feel comfortable walking in? Are you treated well? I mean, you're coming in talking about something that might be very vulnerable to you. You're looking at spending a lot of money or processes and treatments over time. So you're going to spend a lot of time in that plastic surgeon's office. For ladies that I get with breast cancer, we're going to get to know each other very well, because you're going to have a lot of treatments, a lot of not really treatments, but office visits. With me, going through the reconstructive standpoint, making sure that there's no recurrence. You're going to have an oncologist. So, you're going to have a lot of doctor's visits. So I think the staff is extremely important, and you should feel close to them. You should feel like when you come in, you should be able to ask questions. Find out who does your follow-ups. Again, lots of practices do it, and everybody has their individual way of doing it, and there's nothing wrong with that. My feeling is you should have access to your surgeon. You should be able to ask the questions to the surgeon or the person who did the procedure. You know, you want to, if you had a question about your dermal fillers, you need to talk to the injector. If you had something with the esthetician, you need to talk to the esthetician. Not the secretary or the receptionist, not the nurse who's covering for the surgeon. You know, you really need to do that. You're going down a line of trying to, or a path of trying to fix something you want to fix. Those people in that office, the providers, the staff, should walk that with you. And that's my personal feeling. And that's what we try to build here at Bellissimo Plastic Surgery and Medi-Spa, is that patients that come in are treated as individuals. You know that everybody here is supporting you through thick and thin. And I think that's the way it should be. So I want to thank everybody for listening in tonight. Sorry if it was a little long and drawn out in certain areas, but I wish everybody a happy holidays and a really great new year. We'll see you again in January. We don't know the topic yet, but I'm sure they'll come up with something very interesting. Good night.